We are back here on Carolina in the Morning, and we have medical news to tell you about. The Food and Drug Administration has cleared a genetic test for the first U.S.-approved alternative to the Pap smear, the decades-old mainstay of cervical cancer screening. The test is designed to help diagnose HPV in women 25 and older, which causes nearly all cases of cervical cancer. Today, Dr. Lucy Beth Nieves, a gynecological oncologist at Hanover Regional Medical Center's Zimmer Cancer Center, is joining us. Lucy Beth, good morning. Thanks for coming in today.
Thank you.
Tell us why the FDA approved this new procedure for testing after the Pap smear had been used for so many years and continues to be used, right?
Well, actually, the FDA approved this test in 2011. Okay. What changed last week is that they approved for the test to be used on its own. And the idea is this: now we have two options which we can use to help to identify women at risk for cervical cancer. This test detects the virus that causes cervical cancer, the human papilloma virus, and the Pap smear, and its role still is to detect abnormal cells on the cervix. So this is just another way to try to identify these cells on time.
Do you and other physicians still plan to use the Pap smear, or is this something, an alternative that you will be switching over to?
Well, the position of the Society of GYN Oncology as of last week is that we are going to recommend to use either the Pap or this test on women over 30 years old. New guidance need to be established, and I anticipate this is going to happen during this year. But as of now, right now, we're not supporting to use it on that gap of women in their 20s.
Okay, now, when I was doing the intro, we were talking about women over 25. They're the ones that need to be tested for HPV, the virus, HPV, that is, the virus that causes most of the cases of cervical cancer. Is that still the case?
Well, and right now, the problem is this. Many women are going to be exposed to the virus, but we know that only 10% of them are going to have persistence and might develop problems in the future. So that's why we're still debating about that young age to test for HPV, because that population might eventually clear the virus on its own, and we can prevent to do a lot of interventions that might not be necessary if we wait a few years for their systems to clear it. That's why I point 30 years old. Okay.
Early detection of any kind of cancer, though, is still the key to perhaps a successful recovery or successful treatment of cancer.
And the ideal here will be primary prevention, doing the HPV vaccination. That's still the main thing here. We want all our kids to get vaccinated so they don't need to, in the future, have the risk of cancer.
Absolutely. All right. Lucy Beth, thanks very much for coming in and explaining about this new FDA procedure. Over to Colin.